So Kansas is only one of 10 states in the U.S. that hasn't expanded its Medicaid program. And today I'm going to tell you 5 reasons why the Kansas legislature needs to make it happen this upcoming legislative session. First of all, it'll reduce healthcare costs for all Kansans and protect everybody from medical debt. So when Kansans who don't have any health insurance need healthcare, they usually go to the emergency room, right? And then they get a bill that's astronomical because that's the most expensive way to seek out care. They can't pay that bill, and so that bill goes unpaid and becomes what we call uncompensated care for hospitals. And then that uncompensated care goes to everybody else's bill to help try to make up the difference. If that uncompensated care in hospitals goes down, that means your hospital bill and your medical care bill doesn't go up to cover those costs. Under Medicaid expansion, more people have health insurance, and that reduces their need to take out things like payday loans to help pay those costs and reduces that medical debt that many people see. Number 2, it supports a healthier workforce. It's really hard to work if you have a chronic sickness or illness that makes you hurt or feel bad every day. If you can see a doctor before those issues get really bad and get the treatment that you need, then you're going to be a better worker, right? Number 3, it's going to keep our entire state of Kansas economically competitive. All of our surrounding states have already expanded their Medicaid programs, some of them for many years. That means these states are more attractive for workers and for businesses looking to locate there. Number 4, it's going to preserve and strengthen our rural communities in Kansas and the healthcare system there. If you live in a rural part of the state, you already know that sometimes it's hard to get the medical care when and where you need it. You might have to drive a really long way to Wichita or Kansas City to see a specialist or get the care that you need. Medicaid expansion is not going to be a silver bullet for rural hospitals that are struggling financially, but what it is an additional revenue source for them. It's one policy change that can not only help the people in the community, but also the hospital system itself. It's a way to make sure that those hospital systems don't have to reduce the services they offer or close down altogether, like many have in the last 10 years in Kansas. And 5th, it ensures uniform access to affordable health insurance for all Kansans. Your race, your income level, the geographic part of the state that you live in should not determine whether or not you can get access to health care. Black and Hispanic Kansans are more likely to live uninsured, as well as those in the southwest part of the state. Expanding Medicaid gives an affordable option for health insurance for all Kansans, regardless of your zip code. For all these reasons and many, many, many more, it's time for Kansas to expand our Medicaid program like 40 other states in the United States. So let's talk about it. Let's make the conversation get loud. What questions do you have? Put them in the comments and we will answer them.